Dr. Leah, a woman writes, "My partner and I are trying to have a baby. We're both very much into exercise and working out. I recently discovered he was injecting testosterone. Won't that harm his fertility? That's what I've heard."
Well, it could. Infertility is a side effect of testosterone treatment because it decreases the levels of FSH, or follicle stimulating hormone, which is important in stimulating sperm production. On a side note, both men and women have this hormone. FSH stimulates the growth of eggs in the ovaries for women, and it stimulates the sperm production in men. The good news is, most cases, the fertility issues that are caused by testosterone treatment is reversible, and typically men who have received testosterone treatments for shorter periods of time recover a little more quickly. There is a small percentage of men where the infertility is not reversible. It's my understanding that this happens more often in injected testosterone or shots. They're more likely to cause infertility than some of the gels or any other form of testosterone. But keep in mind, they all can disrupt the normal hormonal balance. So to answer your question, if your man could avoid testosterone treatment, he should. He should avoid it until he's finished having children. If he has pituitary disorder that's causing the low testosterone, then he can try HCG. This will increase his testosterone level without disrupting sperm production. Regardless, just make sure to monitor those hormone and semen levels.
A man in his mid-40s writes, "Is there a healthy number of times married couples should have sex each week? We've slowed down a little as we've gotten older, but I want to make sure we don't get stuck."
I think most people accept the fact that relationships often experience a sexual slowdown, but knowing that doesn't make it any less stressful when it happens to you and in your relationship. Many people worry about whether or not they're having enough sex, but whatever amount of sex you're having is okay. As long as you and your spouse are okay with the frequency, then it's fine. But since you asked about a healthy number, married Americans typically have sex 5 times a month or 1.2 times per week. But ask yourself, why are you so concerned? How severe is this change? So I would think going from 2 or 3 times a week to maybe 1 time a week doesn't seem like a huge drop off, but possibly going from 7 times a week down to once a week might feel like an unacceptable decline. It seems like it was a slow decline, so I would ask myself, is there anything else happening in your relationship when you notice that this decrease started? So were there any health issues, any types of family drama? Were you guys fighting? Either of you guys particularly stressed? That's a sex killer. Distracted, health issues, any financial issues, family drama, any additional worries? I mean, our sex lives are very sensitive to the dynamics that occur even outside the bedroom. So, what's the state of your relationship now? Are things generally happy and loving between the two of you, or is there a lot of tension? If you feel like your relationship's good and you're still concerned with the amount of sex that you're having and the physical side, just try to focus on kissing and cuddling. That's going to increase that dopamine and oxytocin. That's going to make you feel good and could potentially lead to more sex. Make sure that you're giving compliments, especially one that are a little bit sexual in nature. Tell her what you think is sexy about her. Set a weekly date night or a weekly sex night where the two of you can just focus on one another.
"I'm a widow, and I haven't had any sexual activity in about 10 years. I think I just want solo sex. Could you point me in the right direction, please?"
It's really common for seniors not to have a partner later on in their life. Sadly, I've heard widows and seniors say, "I'll think about sexual activities again when I meet someone." But then they put off sex for years and maybe even decades, which is going to make it much more difficult to enjoy sex when a partner does show up. So even if you don't care about being partnered again, sex with yourself is important for your health and well-being. So good for you for wanting to engage in solo sex. There's a ton of research that sex, either with a partner or with solo, enhances your health. It improves blood flow, it helps relieve pain, helps with sleep, relieves depression, strengthens your immune system through production of IgA, which helps fight infection and disease. It also lowers diastolic blood pressure, which in turn reduces the risk of heart disease. It just makes you feel happier and it feels good. Unfortunately, all too many of us were taught in sex ed that sex and sexual desire are shameful. I've done a lot of research in sex education, and I'm a huge proponent of sex-positive curricula. Unfortunately, in the United States, we only have two different types of curriculum. One is abstinence only, where you're taught sex is bad, and one's comprehensive sexuality education, where you're only taught about how to prevent STIs and how to prevent unwanted pregnancy. Most of the time, sexual pleasure is never discussed. So clearly, this is going to apply to masturbation. I could go on forever about sexuality education in the United States, but experiment, find out what your special time is. You may notice that you're more likely to get aroused in the morning, especially after caffeine. Caffeine positively affects your smooth muscle or involuntary muscles that you need to be turned on. You might find that you're more likely aroused after a quick afternoon nap. Keep in mind, being tired is also going to lessen the likelihood of orgasm. Typically, also after a meal, you're going to have a harder time than right before a meal. And after exercise may also be a good time. Exercise increases the blood flow, also going to increase those endorphins or those feel-good hormones, which could translate into sexual arousal. Try solo sex after exercising. Also, purchase some lubricants, massage oil, pillows for your hip, your back, your neck, anything that's going to make you feel comfortable. There is actually a website titled Senior's Guide to Vibrators, and there's another one titled Senior's Guide to Lubrication, where the author goes into every detail about everything you want to know. If you decide to purchase any of these things, most sex shops can send everything in a discreet little box, so you don't have to worry about that.
One of our younger viewers writes, "If I tell my doctor that I'm gay, will he or she tell my parents?"
Don't worry, your doctor is legally obligated to keep the details of what you talk about confidential. However, there are two times when a doctor cannot honor your privacy, and that is when someone's hurting you or you're going to hurt yourself or someone else. Anything illegal that you've done in the past is going to be kept confidential, but anything that you might possibly do in the future, your doctor is going to have to disclose. There is one iffy situation, and that comes with testing for HIV and AIDS. In most cases, testing for the presence of HIV and AIDS antibodies is done confidentially. However, if test results come back positive for the disease, the decision to notify your parents really does depend on the state. Some states require that physicians notify parents only if the teen is under the age of 16. Others require disclosure for any age of any minor. The age of majority can also depend on state, the age of majority also being when you become an adult. So in the state of Florida, for instance, it's age 18, whereas Mississippi, it's going to be all the way 21. Other states like California and Delaware will test people up even as young as 12. So at your next visit, make sure to ask your doctor what things can be kept confidential, and ask your doctor who has access to your medical records, either paper or electronic.